So Innova assembled a risk management team, and of course I called this the death panel. Exactly what it was. It wasn't a team to figure out what the problem was. Any first year, second year med school student knows exactly what was going on. Now, I didn't understand what was going on. I didn't understand heart problems because I always thought that if you have like an injury or something, you kind of work through it, or you kind of push yourself or whatever. So, you know, if you're going up the hill, and in fact I had it nailed perfectly in what I wrote to them. I said I was going up the hill and I was short of breath, and when I stopped and took off my shirt and wiped the sweat off, I felt better and my chest was nicely cooled off. Now actually what was really happening is, it's not that my chest was nicely cooled off, it's my chest was cold because it was having no blood. Okay, and I was feeling better because in my case, my chest, my arms, and my legs were all helping to pump the blood. So where the heart was having problems, the other parts of the body were helping to pump blood. So obviously when I took my shirt off, it removed that little bit of, because, you know, if you're talking about a sweat-soaked t-shirt, you know, that's going to be restrictive on the chest. And so, you know, so when that and also obviously they understood very well. They understood very well exactly what was going on, right? So they understood exactly, because verapamil does that. You know, verapamil, verapamil is not meant for, you know, what be the pre-existing conditions. And so obviously I had all those injuries, and it's already like a proven fact where if you have injuries to the lining of your arteries, verapamil can do the opposite. Verapamil is supposed to be what? A vasodilator, right? Right. So verapamil is supposed to be a vasodilator, and that's how it works for high blood pressure. But you know what? What I've read is that when you have endothelial damage to your arteries, you can have the opposite effect. So you can have a vasoconstrictive effect. So that's a horrible drug she gave me, and it literally has all kinds. If you put that verapamil and deleterious, so all kinds of stuff showing up. And if you can see verapamil's warning label, it's unlike almost any other drug. And the only reason she gave me that drug is because she was a liar, because she wanted to mislead me, and so, and you know, hide the real facts. So she gave me verapamil. So anyway. And so obviously I had it nailed right from the start what my symptoms were, and to me, you know, it's no different than like, you know, you have some knee pain or you have some headache and you try to push yourself through. But this was very different, because I've also read the recommendations. What is written is for patients who have like shortness of breath, it is okay to recommend exercise, but you are supposed to stop when you have shortness of breath. So if these doctors told me that itself from the beginning, that would have helped me a lot. And I also find that with these kind of heart injuries, it is possible for it to heal. And I was just like 42 years old, and my body itself was mainly healthy. And you can kind of see how I survived those severe injuries that MRI tech caused. Even though I was unconscious and it's something which should have killed me, I survived. And so, you know, the body is very healthy, you know, can heal itself. So now what I read is, if you have an injury to the heart, it can actually heal itself. So literally, if I had 6 weeks of basically very low activity and a lot of bed rest, my goodness, that problem could have been gone. Okay? So I would not need any medication, I would not need any surgery, nothing. So I know I got that information because I was really wanting to, that's how it was. So I didn't really jump off making any accusations or anything. So really, you know, I actually had the problem with that for 2 months. Now, when I got the problem, I stopped the drug within 5 days, even though the doctor had given me a 90-day supply just to distract me from the other problem. So, you know, I was smart enough to stop the drug with it and responsible regardless of the doctor's harm. So I stopped the drug within 5 days, and I just waited and to see if it will improve. And you know, in 2 months it did not. But even though the rule, but I think even at that point, if I had a good 6 week of rest, right? So it's very possible. And I think eventually a malpractice attorney and expert witness will say just that if I had 6 weeks of rest, that heart muscle and whatever else was going on could have healed even at that 2-month mark, and even probably beyond that stage. But instead, what Innova did, that death panel did, they wanted me to slowly continue to injure myself. So here I am going for exercising and thinking I'm doing the right thing, you know, helping my heart, I'm doing the right thing, kind of getting myself to do extra things, pushing myself. So it's pretty good psychologically. So, but really, a lot of harm was occurring. So they literally wanted to start from a good heart, which they injured a little. I think they injured a little at the beginning. And instead of letting that injury heal, because that's how the heart works. The heart remodels. So when you have one problem, you get more problems. So the one problem doesn't heal, it causes more problems, and that causes another problem. So literally you have this kind of domino effect, and everything goes, right? Now it's kind of, it may be in some ways okay when you're like 85 and you had a poor diet and no exercise and this and that, but I'm 42, I'm perfectly fit. And you can see from my calcium score what my health level was. You know, I have a 0 calcium score, and they say that's not even possible at age 42, or it was tested at age 43. So for a 43-year-old man, they don't even think of a possibility of a 0 calcium score. They look at the lowest you can have is like a 1. And I had a 0. I mean, they're basically telling me that 100% of men my age don't, have, I have less calcification than 100% of men my age. So I really had a good strong heart and everything going, and it should have healed. So these demons at Innova, because of that pervert, Dr. John Cochran, they got into the scheme, and they actually called me back into the office, but it wasn't really for that. They just wanted to see how I present, because you know how it is. I mean, if you look at what they say about the heart, and if you look at if you see what they say about the Bruce protocol and the exercise stress test, it's all about taking the car out for a test drive. And anywhere you see, it's actually, with all kinds of problems, it's very easy for the heart to be okay at rest. So great, okay, you get me at rest, and hey, he's looking great at rest, I guess. So that doesn't prove a thing. Literally the heart has to function in practice outside in the real world. So what happened is, and then because they concealed and they lied, so then another harm occurred just a few months down the road. I went for a root canal procedure, and and the poor dentist did not have the information because of Innova's lies. And so what happened is, I immediately felt a lot of numbness in my left side of my head, and also it looks like the heart itself was injured more, because I'm sure more ischemia came about, because the other problem I had simultaneously was a lot of stiffness in my shoulders and my upper spine. And if you see my radiology report, you know how they say when you get a heart attack, you get pain in your shoulders and spine. But in my case, it's so severe that I actually have severe injuries on my upper spine. Can you see that? And I lift weights and I exercise, and so I'll be the last person who will be sitting around with all these severe injuries on my upper spine. It makes no sense. Okay, and it's incredible how the severe injuries are limited to the upper spine. It's not in the lower spine. It's not anywhere else. So you know what that is, right? Yeah, that's the severity of the ischemia. So my condition is so severe that not just the ischemia is so severe and so intense that it's not just the shoulders and upper spine hurting or having pain. It's actually in my case, that's actually being stiff and it's being injured. So that problem also became worse after that local dental anesthesia. And when I told the doctor that, so they went back and they lied on the records. And now I was trying to move on to another doctor because those physicians were not helping me, and obviously they were concealing and hiding and cheating. And so at least if they could give me my proper records, I would take it, but they just ignored it, and they actually lied the very same day that I was at that dental procedure. They had no idea I was there. I was asking for my records because obviously I would have other kind of procedures coming up. I want to see what's going on. So they didn't even know what had happened, but it just so happened coincidentally the very same day I was having this bad reaction with this anesthesia, this nerve block in the mouth. They wrote down that the doctor gave me a telephone consultation. Now obviously if the doctor did, they would have to prove it, and they don't have any records to prove it. So now I'm still waiting for this item. I need to go to the dentist. I need to have my dentist already wrote down, even in September of, wow, this is 15. My dentist wrote down in September of 2013 that I need to have a couple of extractions right away, and I still haven't had it done, and it's scheduled to be done at the Washington Hospital Center. Now do you want me to go and get them in trouble? Now we have to know what's going on, and I've been telling my doctors ever since, I need to get my complete records. I need the truth. Stop lying, because I was severely hurt, injured at a dental procedure, a similar one. I was not injured 1 year prior. So this only happened after these cardiovascular injuries, that when I had a simple dental anesthesia, I was injured so much more. So I don't want that injury to become worse. Who knows what's going to happen this time? Because this time my heart condition is a lot worse. My heart condition today is not the same as it was in September of 2013 when I even suffered that level of injury. So I'm waiting. Now you don't have to wait for years to get your tooth extracted if you have a tooth pain, but I'm sitting around waiting literally for almost 2 years to get some painful teeth extracted from my mouth because you all are concealing the records. I'm telling my damn doctors, give me a statement to take to the dentist. Give me my full health status. Let the dentist know what's going on. I need this right now. So let me continue to the next tape.